Thank you. So the AI and machine learning was the topic given to me, and so when you really look at the traditional methods of what we follow, we have a lot of subjectivity, and of course the retina person says something different from the fields, and we say something different. So there is a high amount of variability, and also there is a possible human errors. So how AI can really kind of help us is to an extent it can be much more accurate, and the early detection can be possible, but it can really pick up the subtle changes, both the structure as well as the functional changes early. And also looking at the efficiency and the scalability, you can give many images where it can process it very quickly and give us the details. And also once you have one patient's details, it can really process everything and then give us what next to be done, especially when you see the kind of progression. There are different type of AI models one can really look at using it. So first and foremost is the data science. Once the data is given, there is a process called the pre-processing, and then the analysis is been done. Then there is a process called the machine learning, where we have to really teach the machine everything in detail. That is, manual extraction has to be done. But in the deep learning, the manual extraction is not much been done. So the machine does everything. That is called as something called as a CNN and RNN. That is a convolutional neural network, and the recurrent neural networks have been used. That's what we are using now. And there is a hybrid model. Both you can use the machine learning as well as the deep learning models can be used. And there is something called as a multimodal AI models. That means you have a fundus photograph, you have visual fields, you have OCT, everything can be combined and can be used to understand. So what are the imaging modalities that can be used is the normal fundus imaging by the flashlight. Then you have the CSLO images of the fundus photograph. You have the OCTs, you have the numerical data, you have the grayscale data. Everything can be analyzed in the multimodal imaging in the glaucoma AI. So looking at the features, what are the basic features that is being extracted in the AI models is when you look at the fundus photograph, you can see the CDR, the NRR, RNFL, PPA. And similarly in the OCT also including the GCL maps. And if you really look at the visual fields, the data can be separately taken up, and also the grayscale also can be used for the studying how the things are happening, in the same way in the SLO also. So when you do the image processing, what other things have been done in that image processing is the image enhancement. There's a huge amount of noise reduction will be taken care, or something called as a denoising. Data augmentation, vessel segmentation, optic disc and the cup segmentation. The artifacts are being removed, and also something called as a normalization. So as mentioned earlier, these are all the things that is been extracted when you do the AI models. So this is one of the AI models, how it has been done with the various optic neuroretinal rim, cup, everything. So this is what the model which we have used is the deep learning model. Though initially we used only the machine learning, but machine learning is little difficult because we have to teach the machine every time. There is a manual extraction has to be done. So the deep learning we are using, and also the transfer learning. So the challenges are there is a variability in image quality because there are different machines, different technologies are being used. Some people use the RGB, some people use only the RG. So there are various technologies. So it is very difficult to process by different image qualities. So the model level challenges are very difficult to process everything in the same way. It cannot be done in that way, but the AI really helps to an extent. There is something called as a explainable AI model also. We'll just discuss that quickly. And looking at the transfer learning technology, it is the each image is been extracted. Cup is extracted separately, disk is extracted separately, and you can see that everything is been isolated by the ResNet 50. So that is what we have used, but it is not the best of the technologies that we have found, even though we know that we have the best of the qualities by the specificity and sensitivity. It doesn't mean anything to us actually. It is not that great, though the specificity and sensitivity appears to be good. But what we really need is to look at what is the real good explainable AI. That is another model. And there are a lot of regulatory complaints because there is a lot of safety, legal and the ethical standards has to be followed. we need to see how the bias can be reduced, and also the seamless integration is another biggest problem that we face, because we cannot just combine all the machines together in this way. So, and understanding by the doctor also is another area of concern, because whatever the machine says, it is not that you just go and do everything. So this is how the image processing and AI, how you can just go as a cycle, and then you finally give it to the patient of what it is. So this is one of the other models which we have taken up recently, is called as a AGSI. So if you have the fundus photographs like this, where it is completely dark, we can extract completely, and then you can see how the image quality is coming up. So this is what we have been doing now. So it looks quite promising, but we'll have to see how far we can really do it in even when you have the images very poor. So this is what we have already published and presented in one of the AI conferences. We want to really acknowledge Dr. Avanti Bindu from Amrita Institute of College. So is that AI has reached its potential, but still it is not reached, but definitely it has gone quite deeper. And I think sooner we will be having a little better models to be studied, and we can really use it. But as of now, the AI model seems to be better diagnosing than what we all can do at least at this point in time. But we have to see what the future is.